Okay, let's jump right in. We're all asking the same question these days. How is artificial intelligence going to change our jobs, right? Is it going to be this incredible new assistant, making us smarter and more efficient? Or is it the new competitor we should actually be worried about? Today, we're going to use the world of pharmacy as a really powerful case study to get to the bottom of that question. And trust me, the answer matters to every single one of us, no matter what you do.
And look, this isn't some far-off sci-fi movie scenario. We are right here, right now, standing at a critical tipping point where AI is shifting from just a niche tool for experts into something completely different.
So what does this tipping point actually look like? Well, to really get our heads around the massive shift that's happening in AI, we're going to start with an amazing analogy, a story about what happened with internet data over in India just a few years back.
So, think about this. Before 2016, getting high-speed internet in India was a luxury. It was expensive, about 120 baht for just 1 gigabyte of data, and that created this huge digital divide. But then, this company, Reliance Jio, came along and just obliterated prices, slashing them by 90%, and the result? An absolute revolution.
100 million users. Jio signed up that many people in just 170 days. It was the fastest growth in history. This completely democratized the internet there, turning it from a luxury good into a basic public utility, and it unlocked a whole new digital economy for hundreds of millions of people.
Okay, so here's the big connection. That exact same thing, that geo moment, that radical, explosive shift from expensive and exclusive to cheap and accessible, well, it's happening to artificial intelligence right now, as we speak.
You know, until recently, the most powerful AI models were locked behind a paywall, and that created a new kind of gap. You could call it an intellectual divide. But as the technology gets radically cheaper, that barrier is just evaporating. AI is becoming an intellectual utility, as fundamental and available as flipping a light switch or turning on the tap. And that, my friends, changes everything. So, what happens when this powerful new utility is in the hands of not just the professionals, but patients too? Well, it's creating a completely new reality in healthcare.
See, the patient of yesterday was often a pretty passive recipient of care. But the new AI-powered patient? Oh, it's a totally different ballgame. They are an active health partner. They're using AI to understand their condition, to summarize their own medical history, and they're walking into the pharmacy with really deep, specific questions already prepared.
But, of course, this brings up a new and pretty complex challenge, the problem of Dr. AI. First, you've got what are called hallucinations. That's when an AI just makes something up that sounds totally convincing but is completely false. And second, that can lead to anchoring bias, where a patient gets fixated on an incorrect idea from their AI research, which can make a real professional consultation way more difficult. And this is forcing a huge evolution in the pharmacist role. They are no longer just a dispenser of medicine and information. Their new, absolutely critical role is to be a clinical AI conductor, basically an expert who validates information, corrects the AI's mistakes, and acts as a vital mythbuster for their patients. This means it's not about fighting against AI, it's all about mastering it. So this next section is all about the specific tools and skills that pharmacists, and really all of us professionals, are going to need to use AI as a super effective co-pilot.
When you really boil it down, two essential skills pop out. First is tech literacy. And I don't just mean using a computer. I mean truly understanding how AI works, its strengths, and maybe even more importantly, its limitations. Second is data interpretation, the ability to look at what an AI has summarized and find those deeper insights, connecting the dots in a way that the machine just can't.
But the single most important practical skill is something called prompt engineering. Think of it as the art and science of asking the right questions. It's how you communicate with an AI to guide it toward the best, most accurate results, turning a generic tool into your own personal expert assistant.
Let's make this super practical. Look at this example using a simple method called the RTF framework. First, you give the AI a role. Act like a pharmacist. Then, you give it a task. Design a patient registration form. And finally, you specify the format. Present it as a table. By structuring your request this way, you get a precise, high-quality result. Instantly. That is the skill in action.
Okay, so that's the individual level. But what about the bigger picture? How should organizations and leaders be navigating this incredible transformation? Let's zoom out to the strategic level for a minute.
For any leader out there, navigating this really comes down to a clear, three-step action plan.
Number 1, be cautious and manage the risks. Number 2, get ready by preparing your teams. And number 3, keep learning because this field is changing at lightning speed.
So let's break down that first step, being cautious. The primary risk, of course, is AI hallucinations presenting false medical info. That's just not acceptable. Then there's data privacy. Patient data is incredibly sensitive and has to be protected. And finally, there's a sneaky risk of de-skilling, where teams start to rely so much on AI that their own critical thinking skills begin to fade.
Next up is getting ready. And the key here is simple. Start small and start safe. You begin with pilot projects on low-risk administrative work, like maybe summarizing meeting notes. This builds familiarity. But at the same time, it's absolutely vital to establish a clear internal AI governance policy, creating the rules of the road for how these powerful tools can be used safely and effectively.
Okay, let's bring this all together. When we have machines that can process unbelievable amounts of data in seconds, what is our unique, irreplaceable human value? What does it really mean to have wisdom in the age of the machine?
And this, I think, reveals the new hierarchy of value. AI's greatest strength is, and probably always will be, processing data. Our greatest strengths are things like applying wisdom to interpret that data and showing empathy to actually care for people. You see, AI doesn't replace these human skills. It makes them more valuable than ever before.
This leads us to what is maybe the single most important takeaway from this entire explainer. AI will not replace the professional, but the professional who masters AI as a tool will replace the one who refuses to adapt. It is not about human versus machine. It's about human plus machine.
Which brings us right back to where we started. Is AI your assistant, or is it your competitor? The answer, as it turns out, is up to you. It depends entirely on your willingness to learn, to adapt, and to focus on those truly human skills that a machine can never, ever replicate.